Tonight, healthcare reform at what cost? Quebec, doctors under threat. From Montreal, this is Night Talk, episode 13. I'm Gary MacDonald.
And I'm Eddie Tekalik.
And Eddie, you're still here in Montreal.
Yeah, still here in Montreal. Hopefully not for long. I'm not used to all this snow, and now it's raining, and it's going to freeze up, and it's going to snow up. Oh, God, winter.
Yeah, tell me about it. Well, speaking of winter, it might be a long, cold, and hard winter for a lot of healthcare workers. The Quebec government has launched an overhaul of the healthcare system that includes a new Crown agency, Santé Quebec, to run the system, replacing regional health authorities with a mandate to balance the budget by cutting $1.5 billion in spending, and a new bill forcing doctors to work in the public system for at least 5 years or face fines and suspensions. Now, Health Minister Christian Dubé announced the new agency and its head, Genevieve Biron, earlier this year.
Well, I think when we choose, and I've been lucky enough to have, during my career, the chance to choose some managers, and I think you look into many things in one leader. You just don't look at one thing. In this case here, we need some expertise, for sure, and that's the reason I think that was almost a bonus that she was familiar with the health system. Not in the same way as Frédéric is, but she knows about, the system. She knows about, and she knew this gentleman, so she has been in contact with the health system. So we know.
Well, I'm guilty.
You're guilty, are you?
Yeah, let's go back and finish.
Well, I think when we choose, and I've been lucky enough to have, during my career, the chance to choose some managers, and I think you look into many things in one leader. You just don't look at one thing. In this case here, we need some expertise, for sure, and that's the reason I think that was almost a bonus that she was familiar with the health system. Not in the same way as Frédéric is, but she knows about, the system. She knows about, and she knew this gentleman, so she has been in contact with the health system. So we know it takes a lot of credibility when you arrive as a CEO, as a president, and that credibility comes sometimes from the sector. I think the quality that we were looking for is leadership. And I think that the people that have been dealing with Madame Biron when she has been CEO for 15 years, not a couple of years, but 15 years, and she has increased the value of that group, I think the leadership is the other thing. Now, I think the third quality is how to manage people. And I think we have, some issues with our people. They want to have a better environment to work. And I think that within the people that she will be able to bring with her in that small team will be a very strong HR person to make sure that we have a plan with our nurses, with our préposés, with our doctors. Where do we see the professionals in our system to make sure that we work together? So I would say those are the three qualities that we were looking. And as a bonus, we have them in that same person. And she's here today and willing to work with somebody that knows the network. So that's the reason I'm very proud of what we're presenting to Quebecers today.
And I apologize for that heavy thumb of mine a moment ago. Well, Eddie, on top of the mandate to cut, $1 billion from the healthcare budget,
Right.
the new CEO of Santé Quebec will rake in $652,000 for the first year of her mandate, plus a company car. That's a little bit of a tough sell in some respects, but in fairness, she does come with quite a set of credentials as far as success within the business field, especially businesses related to healthcare.
Yeah, agreed. You know what, Gary? I mean, very often you and I speak over coffee or even during the show, and we're always, being critical of our government's decisions and, what are they going to be doing to improve this, to improve that. We talk a lot about the healthcare system here in Quebec being in shambles. You know what? There's good to what's going on here in Quebec in terms of healthcare. I think both you and I, as citizens of this province, have seen the beauty of how well it does work. When both you and I, now that we're getting older and our bones are starting to creak a little more, how well they actually have served us. My mom and dad, when during their latter days of their lives. They were taken extremely well care of. I mean, that's one side of it. So I just want to make sure our viewers realize that we do see some good in our universal healthcare program here in the province of Quebec. But as today's show, we're broaching on today's show's topic of the challenges of the healthcare system in Quebec. We're going to talk about the multitude of areas that absolutely need improvement. I was kind of pleased to see that Dubé is making a decision whereby he is going out of the box. He's going out after somebody who has a tremendous amount of experience in the healthcare industry, if you want to call it, and bringing that individual skill set to bear on a government body that's been struggling for years and years and years. I worked during one of my tenures during my career in medical imaging software and archiving, picture archiving. She was one of our biggest customers, and let me tell you, dealing with her management team, they were really sharp, very intelligent, understood the marketplace, understood what they needed to deliver as part of a value add service to the general community for any sort of imaging that anybody would need here. Very tough to deal with, really, really smart when it comes to money management, but they knew what it was, how important it was for patient care. And their entire focus was on patient care and customer service. So from that perspective, Gary, I'm kind of excited. Let me just put it this way: reserved excitement, where I'm willing, very, very willing, to give her and Dubé the benefit of the doubt that she is an individual that can make some tough decisions and make the necessary changes to improve the parts of healthcare that need improving here in Quebec, i.e., emergency rooms, wait lists for tests, wait lists for surgeries, and that type of thing. So I have to give her some space. I think we as citizens have to give her some space, and the fact that Dubé is going out of his comfort zone and actually engaging somebody from the private sector. So I wish her the best of luck on this one.
Certainly, she has a tall order in front of her. Just getting that budget under control, and far too often it doesn't matter if it's Quebec, New Brunswick, British Columbia, you name it. It's been far too easy for governments to throw money at healthcare, but again, no real level of accountability for return on investment. And the money seems to have gone into this great gaping hole, but wait times increase. The emergency rooms are overcrowded. Hospital beds are full, especially in some of the smaller provinces, with seniors who are there because they have nowhere else to go. If they're waiting for a bed in a long-term care home, and there aren't enough beds there either. So there are a number of issues here that she's going to have to deal with, not to mention the various unions involved and the frontline workers themselves. A lot of those frontline workers are just tired, they're just burned out, especially after going through 2.5 years of a pandemic, and then every seasonal episode that we have, with flu and more COVID popping up, respiratory illnesses and those sorts of things. They're burned out. And I think maybe, Eddie, we're at a tipping point here where it's getting tougher to attract young people to look at medicine, the field of medicine, as a career path overall, and which makes even the competition for quality nurses, doctors, and other medical technicians makes it even tougher to attract them because the competition is so hot at this point.
No, it certainly is. So, I mean, look at Vito. She's there to help overhaul the business model in terms of what it is that they're supposed to be doing and supplying Quebec citizens with healthcare. And then is the other part of the business where, unless you have good, solid frontline employees and workers, companies don't exist. And healthcare, in terms of an overall company entity, is so dependent on two groups of people. You're looking at your actually licensed healthcare professionals, and then you're looking at all the support staff. And both sides of the house right now, there's a lot of issues and challenges in dealing with them. Biron is only going to be able to do what she can based on what the ministry gives her in terms of incentives to educate, attract new doctors into the medical profession. And then the biggest challenge comes: how do you keep them here with everything they have to deal with? With a lot of the young folks nowadays joining universities and going into medical practices, a variety of medical practices. I'm sorry, life has changed for a lot of individuals. Life has changed for everyone. Where you're looking at the hot newcomer coming on board, whether it's the medical profession or any other sort of business environment, it's oh geez, what do you mean I have to work 9 hours? Can't I go home at 5 o'clock? Type of attitude. And I think this is going to become more and more prevalent in the medical profession. They're looking for a work-life balance, and you know what? Why not? Who doesn't want a good work-life balance? And you only have a select few nowadays, I think, that are going to be completely immersed and committed to their profession in medicine. Where I'm going to give up 23 hours of my day to the medical profession, and I'll keep the other hour for myself. I think that's going to be hard to come by, and that type of a doctor is a dying breed. Unfortunately, you just don't have it anymore. So, you're looking at specialty medicine. You're also looking at the big topic of discussion in this province is family doctors, gaining access to family doctors. You mentioned burnout. Recently I went to see my family doctor, who was a very caring, jovial, outgoing individual. Really showed patience and worked with his patients and gave him constructive guidance and whatever else. The last couple of visits, it's like, get out of my office. You've been here for 10 minutes. I got to see the next patient. And I don't blame the individual. This is the government's pressure to do more with less. And, being able to process as many people as possible. And we talked about this before, where I think there was a plan at one point to ask family doctors to stop seeing patients that are relatively in good health, and let's give up your time to patients who are not in such good health and give them some space. So this is the biggest challenge I think this province has, and Ms. Biron has, is attracting talent, keeping the talent, and deploying this talent across a very, very, very huge province. Um, how many doctors are going to want to come out of medical school and go work 500 miles up north for a couple of years? Try to find those kind of people, right? And not pay them much at the same time. So yeah, I know I've said a lot right now, Gary, but yeah, I think we got a big problem in keeping our doctors here and attracting young doctors to study here and to stay here, and to beat them over the head with a stick, the penalty if they don't stay for 5 years. I don't know about you, Gary. If somebody told me I had to stay put for 5 years someplace, I would take a second guess on where I would actually want to apply my trade and my dream. Do I want to do it in Quebec? Do I want to do it elsewhere, where they would be more generous with their rewards and better? better take care of me and my needs as a doctor, or do I head down to the glory land, down to the United States, and make money hand over fist?
Well, that's just it. And coming back around to the older doctors in the system right now, a lot of those doctors, it's nothing for them to be carrying a patient load of 4,000 or 5,000 patients. And when they finally decide to retire, any new doctor coming in wants basically 1,200, maybe 1,300 tops. That's the amount of files they want, because that will allow them to have a better work-life balance. And in some cases that means, taking Fridays off, for example, or not
Right.
having their offices open in the evening, those sorts of things. Can't really blame them, absolutely. Although, with every profession you choose, you have the good points, but there are also some other points where it does cut into personal time, and you have to be prepared for that as well. But I totally understand not wanting to take on a 5,000 or 6,000 patient caseload from a doctor who's been, practicing medicine for maybe 30, 35, 40 years. We are in a different era. We're in a new century even. So a lot of things have changed. The problem is too, on the other side of it, the Medicare system or healthcare system in each province has not kept pace just from a digital standpoint and getting health files, easily accessible by not only the healthcare professionals, but also by the patients themselves. There are steps in those directions, but there's still a lot of concern about privacy, and which blows my mind, because how many government offices, and in some cases some doctors' offices, do you walk into and you still see them using fax machines? Mm-hmm. How secure, how private are fax machines? It just blows my mind.
By hospital wards where they are still using PCs or computers that are running Windows XP as an operating system. Wow. We're talking the year 2000, and this is like you were saying, coming up to the digital age of the 2020s and beyond. We still got some hospitals running on XP. It's just flabbergasted me. That's just as bad as fax machines.
Yep. And that healthcare system should be available right across the country. So if you do travel somewhere else in Canada and you run into a health issue, all they have to do is punch in your number, boom, bring up your file, so they know what they're dealing with right away. But that's not the case. And God forbid that we get involved with something like that right now. They're still trying to figure out that federal payroll system, which has, how many millions of extra dollars has that cost, and it still doesn't work. And I think they're actually starting to think about going in a different direction with it. But how difficult is it? Is it that the arm of politics gets involved and makes it that much cloudier and more difficult to write these programs and get them in place? I don't know, but that has to change. That's part of it. When you look at some of the older doctors and the stacks of paperwork and everything that they have, and there's the other thing too that is a common complaint right across the country, as far as the paperwork that doctors have to fill out in order to get paid whatever they're going to get paid by the Medicare program in their province. That can be a real pain in the butt as well. So there are all sorts of things around that. And we're going to get into something that Dubé is bringing on to try and at least keep the new doctors in the public system for at least 5 years, which, good luck. I can see maybe a few court challenges coming out of this. However, on the other side of it, and remind me if I forget to bring this up about, you can do basically the same sort of thing in the military, but you have to sign up, for a certain period of time so that the military gets its return on investment.
Right. What was the penalty they were talking about? It was by day, I think, right?
I can't remember. Dubé mentions it in a clip that's coming up in a
You know, like
minute, but
fifty to $100,000 a day.
it's significant. It
Something.
really is significant. Yeah, and how are you going to encourage people to stay around, or even want to get in, come to Quebec and study medicine in our universities here if they're facing that kind of a situation. But we'll get into that in a minute. I think
Right.
that this whole thing with the overall reform of the healthcare system, I think if Dubé can keep Legault and the rest of the gang in the CAQ at arm's length so that the new CEO can get on with the job that she's been assigned, then there may be a chance of pulling it together. But when you're looking at cutting $1 billion, there's going to be pain as well, and a fair amount of pain before it gets better. It's going to be tough medicine, and as you mentioned off the top, for the most part, like I have had excellent care in the healthcare system here in Quebec in the almost 4 years I've been here. I can't say enough good things. I don't have a family doctor yet, nor have I ever graced the doorway of the clinic I've been assigned. I haven't had a need to do that. My wife, on the other hand, has had issues with the system, and she does have a doctor assigned at a clinic, but calling in, trying to get the appointment made, and usually it's pretty good once you get through to someone and you're talking to them. The appointments are maybe a day or two out. That's not bad at all, considering, or even on Sundays. But it's getting through that system to get to the actual person who can book the appointment and you can move on, kind of thing. And then you get in, and it's not only doctors in the public sector who are doing this. It's also doctors who are in private practice, where you go in, they just want to talk to you about one thing. That's it.
Right.
Yeah, make another appointment. See you.
Correct.
Sort of thing. Sometimes, to me, if you're a doctor and you're listening and the patient presents without, some really hard, evident symptoms, you've got to talk to them and listen to them and find out what's going on in their environment to kind of see how that relates to whatever the medical issue they feel that they have or that they actually may have. So, this just sort of like, okay, one thing, get out, see it. That
Right.
to me doesn't fly. I don't think that's the right way of doing things either. I can see trying not to get bogged down with the patient who will talk the legs off a cast iron stove. But there are ways of getting around that, and very nicely herding them out the door and, setting them up with the receptionist for another appointment down the road. But, those are all issues I think that have to be addressed as well. But yeah, there's going to be some pain trying to get that balance or the budget back into balance or close to balance. And Dubé says that's something that he's not compromising on. So that remains to be seen as to how long he can, stick with that kind of a thought along the way.
Yeah, I mean we've seen a few stories over the last few weeks since the appointment of Biron. We've seen the fact that it's you're going to be consolidating in your 80s different union representation throughout the entire medical profession in Quebec down to four, which is great from a perspective of negotiating and being able to have frank conversations on how to keep the unions happy, keep the union constituents happy, and keep the employees happy. It's a hell of a lot easier doing it with four than 80 plus different unions. So it's already starting in terms of using some good common sense business practices, and you and I are all about common sense, whether it's on a personal, political, or business level. So it's very encouraging to see that. And you know what, there are going to be pains. I mean, one of the first stories we saw as well is they're going to give it. They've changed their mind. Essentially, they're going to be giving a year to all supporting staff employees, many of whom today, I think there's something like 1,500 employees, have two jobs in the healthcare industry here in Quebec. So you kind of ask yourself two things. One, if now they can only have one job, what are they going to do with the other job? Are they just going to cut back to fold into the $1 to $1.5 billion cost saving? And how essential is that service moving forward? Is it a job that can be folded, or are they just doing it for the sake of saving money? So, that essentially could be a risk, number one. Number two, why would somebody working as a supporting role, supporting staff in our hospitals in Quebec have to work two jobs? Is it because they're not paying enough in the first place for the individual to make a decent living? So there are two things that we're looking at here. So yeah, there's certainly going to be pain. A recent experience for myself, I recently went in for an appointment at one of the hospitals here in Montreal, and I need a blood test. I've been using Clixante for weeks along with my wife to try to secure a blood test. Just can't do it. Like you were saying, trying to get through to somebody or through the system is the daunting task. I can't even get a hold of anybody to talk to. While I was at the hospital, I stopped at the blood clinic. The room maybe had 3 or 4 patients waiting. It was like mid-afternoon. And finally somebody came out to see me, and I asked if I can make an appointment. And I was politely referred to a billboard outside in the hallway saying you have to make an appointment through Clixante, or you have to make a call. And I'm right there. And then I kind of realized what she was doing. That was just the technician that was working in the clinic. And she told me we don't have any more administrative staff to take appointments. So here I am looking around, supposed to use Clixante that tells me there are no appointments available. I look in the room, there's like 2 or 3 patients in the middle of the afternoon. So what gives here? So in that sense, I don't think I can say I was well served. The woman was doing her job. I'm not faulting her. It's the system. So little tiny things like this end up being big things where I finally managed to get myself an appointment to get my blood taken. Get blood out of my arm. I'm more than happy to give it up. I just need to find somebody to take it and then to test it on behalf of my family doctor. Not an easy task. So it's almost 3 weeks now that I've been hunting.
Back in 1998, 99, 2000, I was in British Columbia. And the first time I went to the doctor's office, I went in and, he was checking a couple of things. And he said, I want to do some blood tests as well, just to, get everything up to date. And I said, okay. He said, so here's the requisition. I said, okay, now do I go to Kelowna General, or is there some place in particular I go, and do I have to make an appointment? He looks at me and he says, what are you talking about? I said, well, I have to get the blood work done. So what's the procedure here? He said, go out the door, go around the corner to our blood lab, get it drawn, and he said, I'll have it by the time you get back, sort of thing.
Thank you very much.
Yeah. I was just flabbergasted. And that was back in, 1998, 99. I couldn't believe it. And I'm thinking, why are we all doing this? What's wrong with this system? And he was part of the public health care system. It wasn't some of the offices here in Montreal, for example, where they're private and you go in and you're putting the money down or the plastic down to cover off your visit and any blood tests or anything else. No, they were part of the private system back then. I don't know if that's still the way it works out there. It's been a while since I've been out there, but I just how easy is this? This is, wow. It was
Gary, a couple of years back, I walked into an English Montreal hospital on a Friday afternoon at like 4 o'clock. took one of those tags out and had the blood sample withdrawn, and they wished me a nice weekend. That's as recent as 2 years ago. Can't do that anymore.
Nope.
Just can't. Yeah. So, like I said, I really hope that Ms. Biron really finds her way, gets rid of a lot of this red tape that prevents citizens like you and I in getting a blood test done. And I'm really hopeful that she'll start whittling away at all the bureaucracy, because right now, as far as you and I know, and we've seen this, she's just an added layer of bureaucracy over everything else that's there. Let's see if she's really going to be business savvy as I've seen that she can be. It starts cutting away at some of those executive branches within the hospital system and the provincial medical system. Get rid of that and actually put people in place where they need to be to make the necessary changes, as opposed to just committee monitoring another subcommittee over another chair. I really hope she really looks at this from a business perspective and starts cutting out some of the cutting out the fat, basically, right?
Yeah, exactly. Well, Liddy, as we mentioned earlier, part of the healthcare plan also includes forcing new doctors to work in the public system for at least 5 years. Now, Health Minister Dubé defended the move during a recent media briefing.
No, I think that the way we want to do it is two things. We want to make sure that if they commit, and if the Quebecers commit to invest in those doctors, they need to know ahead of time, over 6 years, 8 years, then when they finish their study, that they will be committed to 5 years. That's very clear. If they're committing to do it, and at the end they change their mind, but the consequences will be very expensive. When we do a bylaw, as we do a bill right now, we give the principle. We say, this is where we want to go. We want to reinforce the public system. Now, how are we going to implement it? I think it goes by rules. Those are the règlements. And I think those règlements... Regulation? Thank you. But I think there is a principle that I think most of them would agree that they need to practice. Sometimes you do bills, you do the projet de loi for those maybe that don't want to respect the rules. So this is the sort of discussion we'll have. I think that the issue that we have, and we have that with the doctors, we have that with the nurses, and this is the reason we went after the agencies, right? You know, the nurses could go without, making sure that they can go in an agency and practice the private. Nobody said that was not the right thing that we did. We have made very clear that they should come back into the public system, and that's exactly what we want to do with the doctors as well. Currently, there are over 2,300 doctors that practice in Ontario that were formed in Quebec, in our best universities. We have between 25 and 50 doctors that within their first 5 years go directly to the private sector. And we form roughly now 1,100. So I'm just saying that I think it's to protect the one that do this sort of transfer. I would say the greater majority don't need that bylaw, but I think we're just aiming at the one that within the first 5 years are going to the private. We need them in public. That's the message.
You know, Dubé impresses me at times. I mean, very logically, you can't really argue with what he's saying, because essentially, if I'm reading between the lines when he mentioned about doctors coming here and taking their training in Quebec universities, the provincial government offers subsidies to universities for post-secondary education. And I guess he's looking at that as, well, we're not really getting a return on investment if they graduate, grab their certificate and head to Ontario or even points south of the border. And one of the reporters did ask, do you have any idea as to how many have gone to the States to practice? And he said, no, that's a number we'll have to look into. But, they had 2,300 doctors or or the last 5 years going to Ontario. So I get the point that he's trying to make there, but on the other side of it, yes, I understand trying to get at least a 5 year return on investment, and apparently there has been a call for that to be as long as 10 years. But he said, well, let's have a look at it starting with the 5 years. And I'm not sure now, if you go in through the officer training program with the military, I'm not sure how that works now, but I know in the past they would pick up and pay for your education, but you had to sign up for, I'm going to say 5 years. It might have been a bit shorter than 5 years, and you were there, and they were getting a return on their investment. And you know what? You were growing in all sorts of manners, not only from a medical standpoint, but also from a lot of other daily life issues and handling different things just by being a member of the military and being involved in some of the situations that they're involved in. So, I kind of get that. It's just that I don't know how much or how hard it's going to be now in the current climate to make that policy stick.
Yeah.
And I think part of it, when I say that, Eddie, I think part of that may be related to also in the legal climate that we find ourselves in at times now. Would that be open to some kind of a legal challenge under charter rights? I don't know.
Yeah.
I wouldn't be surprised that somebody would try to take it and run with it, But then Premier Legault seems to like using the notwithstanding clause a lot.
Right.
Yeah.
Exactly.
So who knows? But to me, there are questions there that, as I went through some of the information yesterday and today, I didn't get full answers or even come close to understanding that what I may be looking at is an answer to it. I sense from the way Dubé described everything that this is kind of like, here's the framework, but all of the points in between that rely on all of the infrastructure of the frame have not been put into place yet. I think they're still floating targets, would be my guess. However, what's it going to mean just having this out there? Is that going to mean that some people in Quebec who are thinking about getting into medicine decide to leave the province altogether and go to, let's say, Dalhousie in Halifax or elsewhere in the country to get their medical education? There's always that aspect that just by the very nature of this policy, it could be enough to be more of a deterrent as to having people enter the medical field in the province here and having them just say, what, I'm out of here and going elsewhere.
Well, the thing is it's pretty much like he's got to run two different programs at the same time. Number one, in the immediate, he's got to stop the bleeding. I think that's what we're speaking about here is the brain drain. And we could talk about all kinds of other professions here in Quebec where there's an ongoing brain drain, but in the medical profession, he's got to plug the hole. Okay. But in the meantime, and I'm hoping with Bidon coming on board, is that from a business perspective, and he spoke very heavily on the human resources element of the medical of Health Quebec, is to understand the underlying root causes behind why A, we can't attract people into medical study, and B, how can we prevent them from going private or leaving the province altogether? So you can't just let things continue slipping while you're trying to clearly identify the second being the root cause. So you put a stopgap measure in place and you say 5 years. Now, in parallel to this, if within 5 years they can clearly identify what the root causes are in Quebec today and maybe plan 5 years further than that, what might be the problems 5 years from now, in terms of people reluctantly staying in Quebec to practice medicine, and identify that and start fixing it. Maybe this 5-year moratorium can at some point will be taken away. That'll be a sign to me that they've actually hit the nail on the head, and our doctors are sorry, young professionals, young people want to go into the medical profession in Quebec, A, and B, they want to stay here because they're getting what they need. And we talked about it earlier in the show, better work-life quality balance. So I think they got to do two things side by side. Number one, yeah, they put this 5-year thing in place. There's going to be some pains. There's going to be some people that are not going to come on board, but maybe it's going to prevent those that are already in the profession from jumping ship. And B, they got to fix why. The whys. Why not? Why don't people want to work here? Why don't people want to practice medicine here? Identify that, because if they don't fix that, nothing is going to prevent people from studying elsewhere, and we're going to be in deeper doo-doo tomorrow than we are today, Gary. That's for sure.
Well, it's as we go along this adventure, and I'm sure by sometime in the spring or maybe early summer, we're going to have a better idea of how this is starting to unfold. And of course, it'll be, we'll be probably revisiting this particular overhaul over the next year or so, on a number of occasions as different things start to come together, and the cuts are made, and the impact of the cuts, and any new programs that they come out with or new ideas that they come out with. So it's going to be really interesting to see what happens, because we're jumping out in front here for sure. A lot of other provincial governments have been talking about it, but really they haven't managed to dive in full with both feet to get the ball rolling. And again, what is the federal government doing? And to me, that's where a lot of this issue starts, is the lack of accountability demanded by the federal government for the money it's forwarding to the provinces. And the fact that, again, as you've heard me say on more than one occasion, we need to bring healthcare in this country under a national mandate, period, so that there's a certain level of service that is demanded and in place from province to province to province to territory. And no matter where you go, you're going to get that level of service. Now, speaking of the federal government, and just before we get into part two, make sure you stick around for part three, because Trump's at it again, and we're going to talk about his latest jabs at both the Prime Minister and Canadians in general. Plus, after we dissect all of that, I have a special gift suggestion for Eddie that I stumbled upon yesterday, and I know he's just going to love it. But first, the Trudeau government has unveiled a new policy for Canada's Arctic to address the shifting geopolitical landscape, evolving security threats, and impact of climate change. The new policy was rolled out last week, and it includes an Indigenous Arctic ambassador to coordinate with Ottawa and our foreign allies. Foreign Affairs Minister Melanie Joly made the announcement last Friday.
Guardrails that prevent conflicts are increasingly under immense strain. Russia's illegal invasion of Ukraine has led us all to ask, who's next? It is clear that Russia has no red lines. Its designs on the Arctic and its resources are well known. They're, after all, our neighbor, and we have to take that into account. But what is new is that Russia is increasingly dependent on China because of its war in Ukraine. It is reversing its historic posture by opening its Arctic to China. And this is fulfilling the long-time aim of China, which has declared itself as a near Arctic state. Russia's military is more aggressive in its incursion into the Arctic. And now China has begun to launch joint operations with Russia. We're seeing more ships in the Arctic, and they're not only doing scientific research. All that is happening while Arctic sea ice is melting. Shorter maritime routes between the Indo-Pacific and Europe are opening. Competitors are seeing new opportunities to exploit natural resources in the Arctic, and what is happening in the Indo-Pacific and in Europe is becoming more than ever connected. The Inuit, First Nations, and Northern communities have been warning us about the changing landscape in the North for some time. Not just the physical changes caused by a rapidly warming climate, but also changes to the geopolitical landscape. Foreign state actors are increasing their activities in the North, and not just on land and sea. We see disinformation and propaganda to undermine our democratic institutions and divide Canadians. We see the targeting of diaspora communities and dissidents, cyber attacks, and espionage. And I can firmly tell you that this is not just a problem that is unique to southern part of Canada. There are northern communities who tell us about being approached by state actors looking to buy land and exert influence in those remote communities. Canada is an Arctic nation, and we are at a critical moment. The Arctic is no longer a low-tension region. We live in a tough world, and we need to be tougher in our response.
Yeah.
Finally, we have a government that's admitting to the fact that we have foreign operatives on our doorstep. Finally, they're starting to take this seriously. Is it because it's one of Trump's real bugaboos in addition to everything else? Or is it because we realize that, China is filling in the blanks for Russia along the northern borders, and that China is looking at the resources that are available in the Arctic? And she's right, with climate change and melting ice and ice flows and the shipping lanes opening up for longer periods of time, it's going to be much easier to get in there to do anything like oil exploration and mining of resources, all of that. So finally, they're taking it seriously, and I was really happy to hear this. But the other side of it is, I'm asking myself, is this something that the Liberal government is throwing out there as another attempt to show that it's still actually capable of governing? And we can talk about that in a minute, because not only was the Foreign Affairs Minister there rolling out this policy, but Defense Minister Bill Blair was also part of the rollout.
Our defense policy provides the Canadian Armed Forces with some of the tools that they need to reinforce our sovereignty in the region. It's going to invest in multi-use infrastructure that the Canadian Armed Forces members and Rangers need to operate effectively. But at the same time, it's also going to ensure that northern communities have access to that valuable infrastructure. It's going to make a difference. And for example, the expansion of the Inuvik Airport runway at the Zubko Airport is going to better support both military and civilian aircraft. The establishment of northern operational support hubs across the north is going to increase our military responsiveness and the ability to address challenges in remote locations on shorter notice. But it's also going to create opportunity for the people that live in the region. Our $38 billion investment in NORAD modernization is going to continue to improve seamless interoperability with the United States, and it enhances our shared air defense as between our nations as we confront the 21st century threats together, including and most importantly in the north.
I stumbled upon a headline on Al Jazeera, of all places, yesterday. and it is, why is Canada scrambling to counter Russia and China in the Arctic. Canada has unveiled a new Arctic strategy to counter what it describes as threats from geopolitical rivals. It's only the latest move in a growing contest for the region. I think that line sums it up quite nicely, a growing contest for the region, because they are, the Russians and the Chinese in particular, they're just breathing down our necks. And also on the other side of the border, Trump, and he's already talked about getting into the oil exploration business in a big way in Alaska, and he's probably looking just across the border and into the Yukon and Northwest Territories and thinking, yeah, okay, there's probably some stuff up there that we're interested in, especially if China cuts off all of our mineral resources required to make chips here at home. So, right. There's just a whole host of things that are going on, and a lot of this, it's been building, but it's like a bad boil now. Like it's come to a head, and it's ready to just kind of and blow. Yeah. Are we too little, too late? What does it really mean, and what is the cost going to be?
Well, this is not something that's recent, Gary. I mean, this has been brewing for decades. Is it something the Trudeau government is kind of bringing up as an issue now because they want to be in the forefront, because of they're lacking in popularity, and they'll do anything to get that popularity and show the Canadian government that they indeed can lead and still are leading the country, or is this just something that they're realizing that, wow, this is really getting bad at this particular point because of the way the world's been evolving the last 4 to 8 years, or changing is a better word. This has been an issue, during Harper's tenure. I mean, they didn't talk about it much. Once in a while, you heard something about the Arctic, but nobody really did anything about it. Prior to Harper's, the Chrétien government, if memory serves, they didn't raise a big ruckus about the Arctic. They talked about the warming issues, and they talked about, we have to protect our borders and so on and so forth. If you remember, during the Chrétien days, this whole thing about correctly outfitting the Canadian Coast Guard with the correct military, with the correct equipment and boats to be able to deal with the Arctic was a big issue back then. And then even prior to the Chrétien, you're going into excuse me, you're going into previous prime ministers where they didn't do a whole hell of a lot. So, okay, now everything is coming to a head right now. You have the Russian aggressions in Europe, and there's nothing to dictate that there won't be any further incursions in Europe, or even to that fact right now, which is our subject, which is the Canadian Arctic. There's nothing preventing them from doing incursions there. And with the Chinese on board, side by side with the Russians, it just makes that threat that much more serious. So from a North American perspective, you're looking at two things that Canada should be worried about. Is number one, what does this mean to Canadian sovereignty? Number two, what does this mean for Canadian business opportunities, or lack thereof, where you have foreign interests coming in and trying to get directly involved with resources, either underhandedly or by buying out companies and buying out permits or whatnot to do their exploration up north. And from a military perspective, of course, the United States has to keep a watchful eye on all of this, above and beyond just the resource issues, as you mentioned, with Trump trying to make oil big again. He's got to watch out for America's business interests as well as its own sovereignty, because what's between us and the Russians is Canada. We talked about this last week. So there's a lot on the table right now. And you know what? Aside from political jockeying, I think that Trudeau and whoever is going to end up succeeding him, or if he does get a next mandate, that this has to be a big deal for us, because we're being pushed from all sides, from the States and the South, and from China and the on the Western Front, or the Far East, if you want to call it, and you got Russia from the north. I mean, we're being squeezed from all sides, both economically, both business-wise, commercially, and at the end of the day, militarily. That is a lot to deal with. And do we have the necessary tools to be able to mitigate all of that, whether it's military equipment or whether it's being able to protect our sovereignty, both business and border wise? I don't know. I think we're hard pressed on this one, Gary. Maybe it is a little too late, too little. I hope not, but it started to look that way.
Well, the other side of it is, if they're investing the money on the military side of the operation, and Blair made mention of it in his remarks, some of that infrastructure that's going in for the military will be beneficial to the various communities throughout the Arctic. On the Canadian side, whether it's extension of runways for air, transport planes and military planes getting in and out, whether it's expansion of fiber optic networks, which some of the communities up there are now starting to push for. New roads connecting communities and with them each other, and also to the southern part of Canada as well. So all of that can have a significant, really, economic spin-off and be beneficial to the population of the North. But at the same time, we're building up our defenses and early warning lines with our two biggest adversaries, who are just looking for any opportunity to get one foot in at a time to start moving in. And as you say, and even Jolie said in her remarks, we are living in different times, and who's to say what's next on the table as far as Putin is concerned, although he's pretty much bogged down in the war with the Ukraine right now. However, if somehow that comes to an end, that will start freeing him up a bit. But in the meantime, he's got his buddies from China filling in the gaps, and they're filling in the gaps more so than what we are doing. And it's going to take us, this is not going to happen overnight, especially from the military standpoint. When you look at the equipment that's needed, the specialized equipment that's needed for fighting in the North, the specialized training that's required for fighting in the North, and having the proper manpower, military power in place, the numbers sufficient to mount any kind of a defense, and also have the ability to move more troops in a hurry to back them up. There are just a host of things, but that's the thing. Time is not on our side, and man, oh man, we really have to start moving on this. And a lot, probably, despite the promises and the hope that was presented in Jolie's remarks, and to a degree in Blair's remarks the other day. A lot of it's going to depend on what that fall economic statement, which is going to come down next week, we're finally going to get it, what that's going to indicate as well overall.
Yeah. Lot to deal with, and you know what? It's you're right. It's not going to be an easy ramp up from a military perspective. I mean, at the end of the day, if something happens next week, Monday, are we in a position to do anything about it? That's what the question is. What is our readiness? And you know what? You're absolutely right. Infrastructures up north are going to be improved. Canadian citizens up north, their lives are going to be vastly improved because of all the infrastructure that's going in, which is great. But the bottom line is what we as a country can we do for any sort of military incursion, or B, any sort of economic incursion by these three countries we mentioned. And I don't know, man. I think we're kind of limited as to what we can or cannot do right now, besides rattling our cages very, very, very quickly and growling. That's the scary part, Gary. We talked about this before in terms of our capability and having an extremely well respected military worldwide. Yeah, I don't know. I don't think we're in any position to stop these countries. I mean, what does Canada do? What does Canada do? Invoke its request for help as a nation of NATO. If some, in case something happens, does NATO respond to assist Canada? Isn't the United States part of NATO? But isn't the United States part of the problem with the incursion of them militarily or commercially up in the Arctic? What do we do with them? So it really is complicated.
Well, yeah, and on
Maybe we should go to Mar-a-Lago more often and have dinner with Mr. Trump, right?
well, on the other side of that, Eddie, is the fact that Trump is the one that is pushing Canada in particular, but other nations who may be behind in their commitment of 2% of GDP spending on their military. And we're still saying, well, we might hit that mark in 2030, I think it is now, it's been pushed out to, much to Donald's dismay overall. So again, this is something that's just breaking. There's a lot of words around it right now and some dollar figures, but the proof will be in the pudding, and when we actually see shovels in the ground and a real push on to get things moving as quickly as possible from the infrastructure in the north, and also getting equipment purchased for the military and getting it into service ASAP as well, to give our troops what they need to operate in that kind of an environment. Now, speaking of the Donald, U.S. President-elect Donald Trump continues to poke away at Prime Minister Trudeau and Canadians in general with jabs about Canada becoming the 51st state. Now, it all began with a shot during the Trudeau Come Dine With Me dinner meeting with Trump in his Mar-a-Lago resort almost 2 weeks ago. It was quickly dismissed by Canadian officials as, it's just a joke, it was nothing. But Trump came back with a couple of posts on his Truth Social platform over the past few days. One of them being this one with him and the flag and made to look like he's looking toward the Rockies. But somebody pointed out that looks more like the Matterhorn. And who knows? I mean, it's Trump. And then we go on to this post I found on Truth Social the other day. And if somebody's having a problem reading it, it was a pleasure to have dinner the other night with Governor Justin Trudeau of the great state of Canada. I look forward to seeing the governor again soon so that we may continue our in-depth talks on tariffs and trade, the results of which will be truly spectacular for all. DJT.
Yeah.
That's our boy.
Yeah. Oh, Gary, I don't know. First of all, somebody should tell him he's not campaigning anymore. Right? He's speaking to Canadians and not his core. Have some damn respect. The fun time and the stupidity and the lying is over. Now it's time to get to business. Now that you're going to be president of the United States again. How serious is he about something like this, Gary? Time will only tell. He's got 4 years to ruin things or make things better, but I think it's probably going to be the former. I think this is just Donald Trump. The question here becomes, and I've seen a lot of comments, is this just Donald Trump and quote unquote the disrespect of anybody in power that's around him politically, like presidents and leaders of countries? Do you have a disdain or disrespect for these individuals, first of all? Or is it just a clear issue of a lack of statesmanship, which we're both very hard pressed to find on any of his platforms and social media, and even on his own platform, he's not statesman-like. You would think he would take the opportunity to portray himself as a leader, or is this guy just bad manners and it's just Donald Trump and I don't care what I have to say. On the world platform where you're representing the United States, and you have to take into consideration what the citizens of a country that you seem to be poking fun at would think of you. Or is this just Donald that he really, really doesn't care? And this is not just now, Gary. If you look at, when was it, 2016 or 2017, the first NATO summit he attended. I mean, that's the first time I think he met Macron, and I mean he had like a foot and a half on him in height, and he just turned around and he starts brushing Macron's shoulder off like he was his little son, and he was wiping the dandruff off his shoulder in front of world cameras. Who does that? That's just a total disrespect for a leader of a country. I think another time, and maybe it was the same summit, they were going for group pictures, and he kind of grabbed this Asian leader by the arm and bulldozed his way around him just so he can get in the front row to take a nice picture. Who does that? So it might be all three. He's just got a total disrespect for anybody else besides himself. Doesn't act like a statesman at all at the best of times, and he's got no manners. I don't know. This whole thing with beating up at his neighbor up north and poking fun at him is just so childish. Like, grow the hell up, man up, do something, be a statesman, pretend to be a statesman, do something to make yourself look like the leader of what used to be called the country representing the free world. Have some self-esteem, something. I don't know what else to say, Gary. I'm out of words. It's just, what a buffoon. I'm sorry.
But he seeks the attention. He loves the attention. Anything he can do to get all eyes on him and people talking about him, he'll do it. He just wants the attention all the time. He's a narcissist, and he's egotistical. He's a case study. Let's put it that way. But
Okay.
a lot of this is still being brushed aside. But with someone as unpredictable as Trump, should we be so quick to dismiss these postings? Which leads us to asking, what kind of game is he playing? I think he is playing a game, there's no question. And is it something Canadians would be open to considering? Would we be open to consider becoming the 51st state of the United States? I don't know. I'm guessing that the answer to that would be a hard no, for sure, especially after watching the campaign this time around and everything that's been happening since he won the election, leading up to Inauguration Day and next month. I doubt very much that most Canadians would be open to even remotely discussing that whatsoever, as to, that may not be such a bad thing. No, hard no on that one for sure.
What was somebody saying that if something like this was to happen, would it be a 51st state and 52nd state divided down the middle somewhere in Canada? So you'll have a west and east.
Right.
The west would be your conservative side, and your east would be the liberal side. And actually, somebody said something to the fact, like, if we did have a 51st and 52nd state of the United States being Canada split, it should be split east to west. Basically, just south of Red Deer, Alberta, everything south of that remains liberal Canada. Everything north of that remains conservative Canada, which he basically said that that's particularly where Trump has got most of his constituents voting for him. So Red Deer would become the capital of the 52nd state of Canada and everything north of that. It's joking aside, you're right, Gary. How much is he actually thinking about this and promoting this, or is this all a ploy in his state of art of the deal, if you want to call it, in playing mind games with Trudeau and everybody else to get him off their their agenda and get him off their focus to give him what he wants. I really don't know. Is he smart enough for something like that? You know what? Probably. I mean, the shysters are very good at that. But I don't know. At the end of the day, you know, if he's trying to get some credibility back on the world platform of the United States and what people view of them around the world, anything that he does good for the world, when he does stupid things like that and says stupid things like that, he just takes them back 5 steps. Like, come on, you know.
Yeah, well,
we got
it'll
some
be
comments.
interesting to see how much longer this goes on as far as the jabs back and forth. Now, Trudeau apparently took a little shot at him earlier today before heading into the Zoom call or Teams call with the premiers to outline what the plans are for dealing with the threat of the tariffs. And so, you know, obviously he's starting to get to Justin a little bit. So Justin's kind of, okay, I'll just throw it back in his direction. So this could be going on for a while. You know, and yeah, well, it is what it is. However, in doing research for this segment of the show, Eddie, and seeing as Christmas is 2 weeks from today,
Here it comes.
I stumbled upon something, and as soon as I did, I said, this is Eddie. He's going to want this for Christmas. And I know as soon as I show you this, you'll be wanting me to send you the details on it, and you'll be asking Santa for it. So are you ready? Here we go.
Honey, I want some eau de Trump, please. Oh, that is good.
Fight, fight, fight!
I like that one. Good one, Gary. Good one.
I knew you'd want that.
That is good.
And you've been a good boy all year, so I'm sure you're going to.
I think my wife just commented, "Hell no, not in my house." Good one.
Yeah, there it is.
There it is.
I couldn't let that pass.
Nice one. Good setup.
I can't wait. I can't wait till you just pour the bottle over yourself and come down knocking on the door.
Pour the bottle. I'm gonna take a bath in this stuff.
Exactly. And with that, Eddie, guess what? That's another show added to the collection. Remember to like, subscribe, and share our videos to help us continue to build this channel. Also, if you're viewing the video at a later time, by all means, please leave a comment below. We welcome your feedback. Night Talk returns in 7 days with our final show of 2024. So from Montreal, Eddie, good night.
Good night, everybody.